Hello, my name is Mina Mohammed Mhawi, Group E1. My graduation project is about the flowable composites, composition and uses. It is supervised by Dr. Ammar Aziz Latif. Back in 60s, when composite fillings were first introduced and they became the choice tooth fillings, but these were quartz filled with large filler particles, making them rough and difficult to polish. So with this polishability being a major concern, other materials came into the market. The first generation flowable composites were designed to simplify the placement technique. They were configured using filler particle size same as the conventional hybrid, but reducing the filler load and increasing diluent monomer. Unfortunately, they had inferior mechanical properties, so it was realized that these flowable composites were neither the same nor adequate substitutes for the highly filled conventional composite. So second generation flowable composite, next generation flowable composites were introduced. Properties of first generation flowables regarding the strength and fracture toughness. The mechanical properties were about 60 to 90% than the conventional composites, so they should be used with caution in high stress bearing areas. Their low filler content made them highly polishable, but reduced their wear resistance. The fluidity varied from one product to product, and the polymerization shrinkage rate was about 5%. For the modulus of elasticity or the elastic moduli, they were in a low-medium range between the hybrid and the microfilled composites. Regarding marginal integrity and micro leakage, since they have higher percentage of resin matrix, so it could be concluded that they could contract more during polymerization, resulting in greater micro leakage. For color stability, translucency was not affected by accelerated aging. For the biocompatibility, an experiment made by Mohammed Yalcin evaluated cytotoxicity of 6 different flowables and he found them to be less toxic. For radio opacity, their low filler content rendered them having low opacity. These first-generation flowable composites were indicated for minimally invasive Class 1 restorations to help restore what's termed preventive resin restoration, since they have the ability to well adapt in these restorations. As seen here in the picture, a molar with incipient caries that was treated or filled with flowable restoration. These flowables were first choice materials for pit and fissure sealants, but appropriate acid etching of surface, keeping or protecting the field dry and contaminated by saliva until sealant is placed and cured is mandatory. They also have been used as cavity liners, as for minimally invasive Class 2 restorations, and also as inner liner for that restoration. They've been also used for Class 5 abfraction lesion, and it was assumed that their use instead of hybrid traditional composites improved the clinical success of these restorations. Here are other applications of these flowables. As seen here in the picture on the left, a fractured permanent central incisor. This case was an emergency and was treated or reattached by flowable composites, as seen here on the right. The picture below, as seen, they were used also for bonding orthodontic brackets. They also been used for lingual orthodontic retainers. Other applications might include repair of ditched amalgam margins, crown margins, block out small undercuts, minimal invasive Class 3, and protective base and non-vital dental bleaching. The advantages of these materials are the high wettability to tooth surface, so ensuring the penetration into every surface irregularity, ability to form layers of minimum thickness, high flexibility and radio opaqueness, availability in different colors, while disadvantages are high curing shrinkage and weaker mechanical properties. Second generation flowable composites. These were developed since the year 2000. They promised increased mechanical properties and were proposed for the use in bulk conservative restorations. They had filler loading of about 50 to 70 by weight percent, being classified as low, medium, and high viscosity, each having its own indication as seen here in the picture. Self-adhering flowable composites are second generation flowables with a filler loading of 60 to 70 by weight. As seen in the timeline below, in May 2009, DiaDFlow was first introduced and marketed for small Class 1, 3, and 5 restorations, also as a pit and fissure sealant. In 2010, VertiZFlow followed, and as seen in 2011, the universe or multi-mode adhesives were introduced. Regarding polymerization shrinkage, the clinicians should be aware that these materials could shrink up to twice as much the condensable composites. For the microleakage, they do not only have low microleakage, but they make a tenacious bond-to-2 structure and protect against microleakage. They have also high radio opacity and high polishability. Simple and easy to use, they have a strong bonding strength when compared with all other groups of the flowable composites. The only issue of these materials that they are almost always applied on newly exposed dentin. So there is no way to avoid them to reaching the bulb through the dentinal fluid flow transport. So all sorts of cell reaction might occur. Advantages of such materials are the better handling properties, since they appear to be less sticky to the application instruments, and better wetting to the dental hard tissue. Well adapted and bonded interfacial morphology, friendly user materials, while the drawbacks were they presented higher microleakage when compared to the conventional flowable composites. And since most of the monomers that used in such materials can absorb water and chemical from surrounding environment, so they release byproducts. Also, they produce deleterious effect due to the physical and chemical processes, biosorption and solubility processes. These materials are indicated for small class 1 and class 2 restorations. As seen in the picture on the left, a curious class 1 lesion that was filled using Flow composite. A 6-month follow-up was made. The filling still looks wonderful, with no complaint was recorded from the patient. Flow is the first self-adhering resin composite that has OptiBond technology in its formulation. It offers high bonding strength, high mechanical strength, and other physical attributes comparable to the traditional flowable composite, with a filler loading of 70% by weight. It has numerous indications like small class 1, base liner for class 1 and 2 restorations, and in pediatric dentistry it could be used as a pit and fissure sealants. It would be a loss for the flowable bulk fill composites to be compared with the high viscosity bulk fill composites, since they have greater polymerization shrinkage and lower mechanical properties, with a filler content ranging from 65 to 83% by weight. Regarding the flexural strength and fracture toughness, it would be ill to make a general conclusion, since every product differs from the other one. They are more translucent than the high viscosity ones, so they tend to cure faster. Regarding the shrinkage, more studies report that they have lower shrinkage stresses when compared to the conventional ones. They also have lower modulus of elasticity as well as lower level of polymerization stress. Their advantages are that they have superior handling properties and ease of replacement, high wettability to tooth surface, ability to form layers with minimum thickness, and this will eliminate air entrapment, high flexibility, so they are less likely to be displaced in stress concentration areas, availability in different colors and radio opaqueness, and finally since they tend to be more translucent, so as mentioned before, they tend to cure faster. The drawbacks were that they require additional capping layer, an increased translucency, since this might cause anesthetical compromises, although these are masked by their capping layer. Their shorter exposure time to higher irradiance render them to have inferior mechanical properties. The shrinkage of such flowables were somewhat around 3%, and it's more difficult to achieve tight proximal contact with the adjacent tooth. Indications for bulk fill flowable composites are to be used as the base under class 1 and 2 direct restorations. As we can see in the first picture, we have a molar that has a lesion on its cusp. It was restored with SDR, and then a 2 mm capping layer of aesthetic composite was placed above it. Below we can see a defective pit and fissure sealant that was removed and replaced with SDR, which looked more aesthetic and more acceptable than the previous one. These materials could also be used for undercut blowout, repair of small defect in aesthetic direct restorations, repair of small enamel defect, and other repair of acrylic resin temporary materials. The SDR or Smart Dentin Replacement is a posterior bulk fill flowable base that comes in a single component, fluoride releasing, and has a self-leveling feature. It's available in one universal shade and has a filler content of 45% by weight. If we look into the picture, we can see the addition of Flow Plus to the SDR. This means that this is a new formulation of the SDR that has new shades of A1, 2, and 3. It has increased enhanced properties, and it indications that includes the class 3, 5 in addition to class 1 and 2, and reduces the placement time by 40%. The flowable nanohybrids have lower filler content when compared to the universal nanohybrid composites, ranging from 60 to 80% by weight. Even though there are few studies about the properties of the universal and flowable nanohybrids, but we were able to conclude that the flowable composites of Grandioso flow, Tetric flow, and Venus diamond flow were acceptable alternative to the universal material of the same manufacturer. The Grandioso flow is a nanohybrid flowable type of composite that has a high filler load of about 80% by weight. It offers various outstanding physical properties along with its less polymerization shrinkage, and has many advantages of color stability, low shrinkage, non-stickiness, prolonged working time under ambient light, good wettability, excellent polishability, and less cytotoxicity and good abrasion resistance. Since the inception of initial formulations, multitude of flowables been undergone continuous evaluation and improvement. Dental technology leader GC Europe has launched two superior flowable materials, Genial Universal Flow and Genera Flow. These materials have high filler load and homogeneous dispersion of filler, so resulting in improved strength and wear resistance. As seen in the picture, a Genial Universal Flow that has filler loading of 69 by weight, which is a radio-opaque material and has a high viscosity, making it ideal for placement in class from 1 to 5 restoration. In operative dentistry, with the improvement of flowable composite materials, they have gained the popularity of being versatile material of choice in today's clinic. As we can see in the picture, a class 3 defective filling that was removed, and then the preparation area was etched for 15 seconds with phosphoric acid, and then an adhesive bonding agent that was placed over the surface and allowed to dwell for 10 seconds, dried for 5 seconds, and light cure for 10 seconds. Then a clear siloxane matrix was placed over the maxillary arch, and an opacious A1 shaded flowable resin composite, a Genial Universal Flow, was injected into the preparation through a small opening and light cured through the clear matrix. Then the interproximal zone was inspected with unwaxed dental floss, and as we can see in the last picture, the completed class 3 composite restoration. Sometimes patients might complain about having invaginations on the occlusal surfaces of their molars due to bruxism. So after the correct shade being taken, a diagnostic wax-up is made to establish the original anatomic form, and a clear polyvinyl siloxane matrix is fabricated and a small opening is made above each tooth to be restored. And then teeth, including enamel and dentine, are etched with phosphoric acid for 15 seconds. Then an adhesive was applied and allowed to dwell for 10 seconds, dried for 5 seconds, light cured for another 10 seconds. Then the A1 shaded Filtex Supreme was injected through the small opening above each tooth and was cured for 40 seconds, as we can see here the post-operative view. They also have been used for developing form, contour, and incisal edge position, as seen in the case above, a preoperative view. Then on the right picture, we can see a postoperative view after being restored with Filtex Supreme Ultra. They also used for resin bonded bridge, as we can see the patient having missing lateral incisors, and her bridges were bonded by opacious A1 shaded flowable composite, which is a Genial Universal Flow initially, and then injected with B1 shaded flowable resin composite. They also been used for developing post-encore, as we can see in the picture on the left. There is a failed endodontically treated upper right central incisor that was restored with A2 shaded Genial Universal Flow. While in the next case we have a primary molar that was restored with an A3 shaded Genial Universal Flow. Flowable composites currently in orthodontics have proven to be versatile workhorse in various procedures, claiming to have multiple uses in the near future in this field. They've been used for reactivation of coil springs, tie cantilever arches, crossbite correction, opening of the space of myline teeth. As these pictures below show, they've been used for tongue spurs to prevent irritation, fabrication of the button hooks for attachment, and also for securing irritating wire components. Nowadays, the highly filled flowables expanded the range of indications in orthodontics. Like as seen in the picture, this patient complained about having spaces between her teeth. So they've been filled using a one-shaded flowable resin composite, the Genial Universal Flow. Also, they've been used for bonding lingual orthodontic retainer. As seen, it was bonded using an A1 shaded Genial Universal Flow also. In prosthodontics, dentures require routine maintenance, since they're like any object, prone to fracture, discoloration, or even getting milled. So flowables came to solve such problems. They came to be used for replacing the missing denture tooth or maybe even repairing a fractured denture tooth. This old lady had a chief complaint about having poor aesthetics in her maxillary denture, specifically a reverse smile line. Her problem was solved using flowable composites to correct the anterior teeth and the contour of the posterior teeth. As seen in the picture on the right, she is really happy with her new smile.